Hello everyone, welcome back to Patient Knowledge. I'm Dr. Kirmani and today I'm going to be talking about an important condition called high blood pressure or hypertension. So let's get started. In this video, I'm going to be talking about the overview, causes, symptoms, risks, treatment and diet. So your blood pressure is regarded as high when it rises to an unhealthy level. There are two types of blood pressure that we measure, systolic and diastolic. The systolic blood pressure is the pressure at the moment the heart pumps the blood into circulation, and diastolic blood pressure is the pressure when the heart relaxes and takes in blood. The blood pressure is measured in millimeters of mercury. Normal value is around 120 over 80 millimeter mercury. 130 over 85 is regarded as borderline, and 140 over 90 is called as hypertension or high blood pressure. Let's look at some of the causes of high blood pressure. It is divided into primary and secondary. Primary or essential hypertension is where the cause is not known. So genetic predisposition, environmental factors, and physical changes are some of the factors that influence this type of hypertension. Secondary hypertension is due to some conditions affecting the organs of the body, such as kidney disease, alcohol abuse, adrenal gland problems, thyroid gland problems, and side effects of medications. Now, hypertension is regarded as a silent killer because a person may not be aware that he or she has high blood pressure since there are no symptoms at all. But it imposes a major risk for heart disease and stroke because it tends to damage the target organs internally. The symptoms of high blood pressure, as mentioned earlier, it usually has no symptoms at all, and one cannot feel any, or it's rare to feel headache, palpitations, or sick until complications develop. So if you are 40, get it checked yearly. What are the risks of hypertension? Stroke, heart attack, heart failure, kidney failure, and loss of vision are some of the very serious complications or risks of high blood pressure. DASH is the dietary approach to stop hypertension, and it emphasizes on having a low sodium diet, eat lots of fruits and vegetables, take low fat dairy, eat plenty of whole grains, fish, poultry, and beans, and eat less of sweets and red meat. Now, the treatment of high blood pressure is through self-management and medication. Self-management I'm going to talk in detail in a bit. Let's look at the medication, how it works to lower the blood pressure. Tablets help by relaxing tight arteries. Some of the medication helps by reducing the body chemicals that control blood pressure, while others can cause softening of strong pumping action of the heart. Now, self-management of high blood pressure includes increasing activity and exercising more. So 40 minutes of walk for 5 days a week is usually recommended. One can increase their physical activity by using stairs instead of lifts. Walking instead of driving, doing household chores is ideal. Gardening is preferable to increase the activity levels. Going for a bike ride is a good idea, and playing a team sport is encouraged. There are some effective ways to lower high blood pressure. So consider losing weight if you are overweight or obese. Cut down on sugars and refined carbs. Low carb diet is recommended. Eat more potassium and less sodium. Here I would like to mention that if you have any kidney disease, consult your physician before starting potassium diet. Eat less processed food because it has high salt. Stop smoking. The chemicals in tobacco can increase blood pressure by damaging the blood vessel walls that causes inflammation and narrowing of the arteries. Reduce stress. There are a lot of different ways to relieve stress. So find out what works for you. Deep breathing, take a walk, read a book, or watch a comedy. Try meditation or yoga. This will help to relax your mind and body. Drink less alcohol. Says 2 standard drinks per day for men and 1 for women is usually recommended. That's the safe level of drinking. Cut back on caffeine. Eat healthy, high-protein foods. This will compensate for the fats and carbs and keep you full. Now eat some dark chocolate. It has flavonoids that helps to lower the blood pressure by opening up the arteries. And sleep deprivation is also one of the causes of increased blood pressure, so make sure you get good, restful sleep. Well, that comes to the end of this video. I hope it was useful. Thank you for listening. If you like this video, like and subscribe to my channel. Also, press the notification button so you don't miss out on any of my videos. If you would like to hear about any topic, please leave it in the comment box below. Bye for now.